Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Ganglion blocking agents. The ganglion blocking agents are of two types. We have competitive ganglion blockers and we have persistent depolarizing blockers. So competitive ganglion blockers are actually quaternary ammonium compounds. Those are quaternary ammonium compounds which include hexamethonium, pentolinium, hexamethonium and pentolinium, whereas amines include secondary or tertiary amines. Like these amines include mecamylamine and pempidine. Then we have monosulfonium compounds. Monosulfonium compounds include trimethophan and we have camphor sulfonate. Monosulfonium compounds are trimethophan and camphor sulfonates are the competitive blockers. Whereas persistent depolarizing blockers include nicotine, which are used in larger doses, and we have anticholinesterases. These anticholinesterases are also used in larger doses. So these are the ganglion blockers. So they are of two types, competitive blockers and persistent depolarizing blockers. Competitive blockers are quaternary ammonium compounds like hexamethonium and pentolinium, amines like secondary or tertiary amines, which includes mecamylamine and pempidine, monosulfonium compounds, which are trimethophan and camphor sulfonate. Whereas persistent depolarizing blockers are nicotine, which are used in larger doses, anticholinesterases, which are used in larger doses.
thank you and thank you for watching.